Number 4, fiction, the myth of the miracle cure. All right, let's bust another myth. The idea of the miracle cure. This fiction usually sounds like take this herb and you'll never get this disease, or sensational claims that a single herb will 100% prevent or cure a complex illness. You've probably seen clickbait headlines on social media posts, for example, turmeric prevents Alzheimer's, or ginkgo biloba will cure your dementia. Big Pharma doesn't want you to know. As much as I love turmeric and ginkgo, I'm here to tell you no one herb alone is guaranteed to cure any serious diseases, especially not on its own. Let's use those examples from before. Turmeric and its main constituent, curcumin, has been researched for cognitive health and Alzheimer's disease. It does show some promising anti-inflammatory and antioxidant effects in the lab, which might be beneficial to the brain. However, this is important. Clinical evidence in humans is not conclusive. There have only been a few clinical trials on curcumin for Alzheimer's and dementia, and the results have been inconsistent and limited. In plain terms, we don't yet have solid proof that taking turmeric will prevent dementia. A 2016 clinical study in healthy older adults found that curcumin had limited influence on cognition over 12 months. Researchers say more studies are needed to see if it could slow neurodegeneration. So it's fiction to claim turmeric is a miracle brain cure at this point. It's a helpful herb, yes, in many different capacities, and it might support overall health or reduce inflammation, which is good for the brain, but it's not a magic shield against Alzheimer's. Now, ginkgo biloba, often touted for memory and cognitive function, has been used in traditional medicine for centuries, and some small studies suggest it could help cognitive impairment. But when it's put to the test in large, rigorous trials, the story changes. A huge clinical trial with over 3,000 older adults found that ginkgo did not significantly prevent dementia or Alzheimer's disease as compared to placebo. The National Center for Complementary and Integrative Health states it plainly. There are no conclusive evidence showing that ginkgo biloba can prevent or slow dementia or cognitive decline. Later reviews are mixed. Some analysis hints that it might help symptoms in those who already have dementia, but even those find the evidence quality is variable and not fully convincing. So, ginkgo is not a guaranteed brain saver either. The broader point is, be wary of any claim that any single herb is a miracle cure for any complex condition. This kind of hype is something reputable herbalists actually push back against because it sets people up for disappointment and distrust. It's similar to how in conventional medicine we'd view with skepticism any single pill that claims to cure all forms of cancer overnight. We know biology is complex. Herbs can be part of a holistic approach to preventing disease. For example, an overall anti-inflammatory diet with turmeric as one component, plus exercise, plus mental engagement and social support, might altogether support brain health. But giving all the credit to one herb is oversimplifying and usually overpromising. This doesn't mean herbs have no value for serious conditions. They absolutely can be supportive and sometimes curative. For instance, certain herbs might help manage symptoms to improve quality of life. Turmeric might help some people with inflammation-related issues. Ginkgo might improve circulation a bit, which could aid in memory issues. But supportive is different from a cure-all. At Deep Roots, we take an evidence-informed approach. That means we get just as excited about herbs' potential as anyone, but also we read the research and temper the claims to match reality. If current evidence is insufficient to say something definitive, I'm going to tell you that openly. Trust is built by being honest about what herbs can and cannot do given the current knowledge. So when I teach, for example, about herbal approaches to brain health, we'll include herbs like turmeric or ginkgo as part of the conversation, but we'll frame them appropriately. Great as daily supporters, not magic bullets. I even debunk some of the hyperbolic claims from marketing companies as part of our course content. Because an empowered herbalist should be able to separate fact from fiction out there on the wild internet. So don't buy the hype of the miracle cure myth. Use your critical thinking, which you're clearly doing right now. The truth is exciting enough. Herbs have many benefits, often multiple ones that add up and can maintain health or address mild to moderate issues. They shine in prevention and in early intervention, and in serious diseases, they're often complementary to, but do not replace comprehensive protocols or systemic care. When someone says, this one herb will cure everything, that's your cue to raise an eyebrow. Healing is usually a mosaic, not a single magic tile. Now for one of my favorite facts. Herbal medicine and modern medical science can work together, not against each other. There's a common misconception that you must choose one or the other, like it's either you're an herb person or you only trust doctors and pharmaceuticals. This is a false dichotomy. The most powerful healthcare combines the best of both worlds. Think of it as complementary or integrative medicine. A growing number of healthcare providers and institutions recognize the value of integrating herbal and alternative approaches with conventional medicine. Did you know that most allopathic medical schools in the U.S. now offer instruction in complementary and alternative medicine, including herbs? It's true. A survey of U.S. medical schools found that the majority included some complementary and alternative medicine content, such as herbal medicine, acupuncture, and nutrition. Even future doctors are learning about herbs alongside anatomy and pharmacology. That tells you that the walls are coming down. In fact, by 2011, 42% of American hospitals reported offering one or more CAM therapies to patients, like herbal supplements, acupuncture, massage, etc. And that number has only grown since then. Major hospital systems, even the VA, have integrative health programs. So if anyone suggests that herbal medicine is anti-science or anti-doctor, point to these trends. The medical establishment is slowly but surely embracing a more holistic model that bridges traditional wisdom with modern science. From a practical perspective, what does working together look like? It means using herbs in areas where they're effective and consulting doctors for medical intervention if necessary. For example, you might use herbal teas, diet, and lifestyle changes to manage mild hypertension for as long as possible, but also monitor your blood pressure with your physician and stay open to medication if it becomes needed. Or you might use ginger and acupressure for mild nausea, but if you have severe dehydration from vomiting, you'll go and get that IV at the ER. There's no shame in either tool. They all have their place. Higher care often provides the acute and intense life-saving interventions like surgery and antibiotics for more severe acute infections, where herbal interventions shine in chronic care, prevention, and supporting the body's terrain. They complement each other beautifully. I always say, use the right tool for the job. If I break my arm, I want an orthopedic surgeon, not a comfrey poultice, without setting the bone. And when I get home, sure enough, I'm going to be using a comfrey poultice to help it heal faster. If I have a cold, I'm going to reach for herbal formulations, tea, and rest, not immediately run to urgent care. I might later go for a sputum culture if the herbs are not doing their job, so I can do a better job at targeting the herbal protocol. It's all about balance and choices. It's also worth noting that many doctors, nurses, NPs, and PAs use herbal supplements or recommend them. Surveys have shown a substantial percentage of physicians and nurses using CAM therapies personally, and many are open-minded and they collaborate with clinical herbalists for patient or client care. This teamwork approach is something we emphasize in our community. We're not here to bash doctors. I love and need my higher care team for many things. We're here to fill in gaps and to empower individuals in day-to-day maintenance of health. On a cultural level, I believe and have witnessed that integrative approaches are the future. People are tired of the silo mentality. You can have your chamomile tea and your ibuprofen and your meditation app all in one toolkit. Whatever keeps you healthy and whole is fair game. Our ancestors didn't separate folk medicine from real medicine at all, just medicine. So that's a fact. Herbal tradition and medical science are partners, not enemies. Each can enhance the other. If you're learning to make your own herbal medicine at home, you're not saying, I will never see a doctor again. You're actually becoming an active participant in your health, which can make interactions with your doctors even more productive if you have a forward-thinking care provider. You'll have data about what works for you. You'll be able to better ask questions, and you want to even teach them a thing or two about herbs that they didn't know. One of my joys is when a student says that their doctor was impressed that they lowered their cholesterol with diet and herbs, and now the doctor is curious about what they did. That is bridging the gap in real time. A quick side note, always keep your healthcare providers in the loop about which herbs or supplements you're taking to watch out for any interactions. A good integrative practitioner will welcome that information. Communication is going to equal safe integration. And that leads me to number 6, fiction. If I make herbal medicine, I'll never need a doctor again. As we were talking about before, the notion that if you start making and using herbal medicines, you'll never need a doctor again is simply not true, nor is it the goal of herbalism. I'm a huge advocate for self-care and community herbalism, but I will never tell anyone to swear off doctors forever. Unfortunately, I've encountered quite a few voices in the natural health world that imply you can replace doctors entirely if you use herbs for everything. That kind of absolutism is not only incorrect, but can be really unsafe. Herbal medicine is wonderful for many things, boosting your immune system, handling routine ailments like colds, stomach upsets, mild skin issues, poor sleep, stress, etc. It excels in improving overall wellness and addressing root causes of imbalance. Many families find that once they know how to use herbs, their visits to the clinic for minor issues do reduce. They need physicians and hire care less often. A jar of thyme honey might head off that sore throat from turning into something worse. A cup of valerian tea might save you from needing a strong sleeping pill now and again. And that's fantastic. But herbalism has its limits, just like conventional medicine has its limits. Let's be real. If you suspect a heart attack or stroke, please don't chug any herbal tincture and meditate. Call 911. If you have a serious infection that's rapidly spreading, that might be a time where antibiotics are life-saving, and using them with herbs at the same time is even more important because they will decrease the risk of antibiotic resistance. There's a reason modern medicine was developed, and it's brilliant in its triumphs. The idea that you never need a doctor again is harmful because it sets up an unnecessary either-or mentality, and that can delay critical treatment when needed. Also, there are certain diagnoses or conditions where having medical supervision is really important, even if you're incorporating herbs. For example, diabetes. Herbs like bitter melon or cinnamon can help with blood sugar, but you still need to monitor your levels, and sometimes you truly need insulin or other medications to stay safe. One could certainly reduce their dependence on medication with lifestyle and herbs, which is awesome, but it doesn't mean you should shun all doctors. Think of herbal medicine making as your first line of defense and a way to enhance your health span, not the be-all, end-all. We teach our students to develop something called home herbalism skills. Much like first aid, you handle what's manageable at home, and you learn to recognize when something goes beyond the scope of that. Being an herbalist at home actually makes you more attuned to your body, so you can tell earlier if something needs extra help. And that's a great thing. You'll know, hey, I've tried my usual herbal toolkit for this nagging cough, but it's getting worse instead of better. Time to see a healthcare provider. No pride lost there. Knowing when to bail is one of the many skills I teach in my classes. The best outcome is when you build a supportive health team for yourself, you being the central player because it's your body, herbs and nutrition as daily staples for health hiccups support, and then doctors and specialists as consultants for when you need their diagnostics or treatment. There's also a growing field of integrative and functional doctors who are very herb friendly. Connecting with an integrative care specialist can be super important and helpful and provide you with the best of both worlds in one visit. So if anyone suggests that making herbal medicine at home means you're against doctors or that you're magically never going to catch or have a serious illness, remember that's fiction. Life is unpredictable. Modern medicine is a blessing, and in emergencies and in specific cases, life-saving. Using herbs is not about rejecting conventional medicine. It's about enriching your health and enriching your toolkit and hopefully preventing or minimizing issues so that you don't need heavy artillery. I like to say, I hope I don't need a doctor often, but I'm sure glad to have them when I do. And I'll do everything I can with herbs, food, and lifestyle to stay as healthy as possible. We've covered a lot of ground in this fact versus fiction journey. By now, I hope you see that herbal medicine is a credible, enduring, and empowering form of healthcare, one that's growing in popularity for all the right reasons. Yes, herbs must be used with respect and knowledge. And no, they're not one-size-fits-all miracle cures. But they offer real benefits backed by both tradition and an increasing amount of science. And crucially, herbal medicine complements modern medicine. It doesn't have to compete with it. So why does making medicine at home make sense in 2026? Because it gives you agency. It reconnects you to your roots. It reconnects you to nature and to ancestral wisdom while also allowing you to take advantage of modern insights. In a world where healthcare systems can feel impersonal, making your own herbal remedies is deeply personal. It's a way of caring for yourself, your family, and your community with intention and love. It builds resilience. It also is more sustainable and affordable in the long run. Plus, there's just something super satisfying about saying, I made this remedy and it helped me. Trust me, that feeling never gets old. If you're feeling inspired and you want to go from cautious to confident in your herbal journey, I invite you to take the next step with guidance. I've put my 15 plus years of foraging and herbal practice into creating an in-depth program where you can learn advanced medicine making skills in a supportive and fun environment. It's called the Advanced Herbal Medicine Making course, and whether you're a beginner or you've dabbled in herbal teas, this course is designed to fast track your competency and confidence. We start from the foundations and build to mastering extractions, formulation, and therapeutic applications. I cover over 12 modules. You're going to learn to make more than 20 different types of herbal preparations, from teas to tinctures, salves, and syrups. Basically, you'll become the person that has a remedy on hand for anything. You'll also become a part of a vibrant community of like-minded herbal enthusiasts, because learning together makes the journey a lot more fun. If that resonates with you, check out the link in the description or visit our website for more details on the Advanced Medicine Making course. If you found this video helpful, please give it a thumbs up and consider subscribing for more herbal insights and tutorials. We have lots more to explore together, and do share your thoughts or experiences in the comments.